Hello, everyone. Today, our team will present a case study on integrity and accountability in medical practice. This presentation will examine a real life scenario faced by a teammate that tested his commitment to ethics and integrity under pressure. We will walk you through the story, talk about the responsibility and accountability, identify the key ethical challenges, and analyze the consequences of a doctor's decision.
Hello, my name is Behrang. I'm a physician and I want to share this story with you. It was during the COVID 19 pandemic that a 7-year-old girl came to our busy clinic with her mom. She only had vomited twice since morning, and other than that, she looked perfectly fine and healthy. She cooperated well through the examination. Despite the overload, I did a thorough examination, but I missed one tiny thing and was checking her pupils. Well, after that, because our clinic was located in a low-income area, and I knew that I couldn't expect a high compliance from the mother for oral rehydration. I prescribed IV fluids and I asked them to stay in the clinic under observation. Her mom was really worried about the COVID exposure, and she wanted to leave. I just told her to come back if the symptoms, persisted or if it got worse, and they left. Sadly, that same night, the little girl passed away in her sleep. It was quite shocking. It was a tragedy, and I was, thinking about my role in this. After an autopsy, we realized that she had methadone in her system, and a few days later, it turned out that the father was struggling with addiction, and unintentionally exposed her, to methadone. And after this happened, there were people in the clinic, including the clinic owner, that suggested we alter the medical records and put the pupil examination in there to avoid consequences for me and for the clinic. But eventually I refused to do that. Even after, I went to the medical council and they asked me if I had done the pupil examination. I just told them the truth and decided to, stick to my principles.
What are the responsibilities and who is accountable? The doctor, as a care provider, has many responsibilities, including diagnosing, treating patients, ensuring patient safety, clear communication, following ethical and legal standards, and appropriately documenting care. In this case, the doctor missed an important part of examination and must be held accountable. But is the doctor the only one to be accountable? Following this incident, the medical council held a review session, thoroughly examined the documents, and held the doctor accountable before a panel of experts. However, the government also bears accountability for ensuring that regulations are in place to prevent doctors' burnout and overload, which are known to increase the likelihood of the medical errors. Currently in Iran, there is no supervision of doctors' working hours or patient loads, which adds to the strain on the healthcare workers and can lead to mistakes. A lack of regulatory oversight and work life balance standards for healthcare professionals, including physicians, has been shown to contribute to poor mental health outcomes, increased burnout, and compromised patient safety. This girl's story shows how negative social determinants like being born and raised in an unprivileged area can lead to adverse outcomes. Additionally, we believe that girl's father should be held accountable for leaving methadone within her reach while her mother had a responsibility to protect her child by trusting the doctor's judgment and staying in the clinic.
This situation highlights how maintaining empathy, honesty, and dedication to patient care build trust both from the community and the authorities. Even though the doctor made minor error, the mother chose not to press charges after witnessing his compassion and diligence. She acknowledged the father as responsible for the unfortunate incident. The medical council also recognized the doctor's efforts and honesty, issuing only a written reminder to be attentive to detail in the future. So, this case scenario emphasizes how leadership rooted in values. As Kramer suggests, Those who prioritize values and integrity build an environment where trust and honesty thrives. In this case, the doctor's action created a ripple effect, encouraging others to follow the suit and maintain high ethical standards.
Moving on to the reflection part, what could have been done differently? In this case, a deeper conversation with the patient's mother, emphasizing the critical nature of staying for observation, may have led to different decisions. Additionally, more assertive communication highlighting the consequences of leaving without a full examination could have influenced the family's decision. The physician could also have sought a second opinion. Healthcare providers under immense pressure often struggle to make optimal decisions, which can lead to misdiagnosis as seen in this case. Overworked staff and limited time during crises like COVID-19 can exacerbate these issues, and systemic inequalities further hinder patient care. Moving on to the recommendations, addressing systemic gap requires stronger communication protocols and enhanced patient education. According to Rosen et al. 2012, voluntary organizations can play a key role in educating families about addiction risk and other health factors significantly influencing patient decisions. As Aldrich 2008 highlights, implementing self-regulation measures within clinics could be beneficial to address issues such as excessive working hours and patient load. In conclusion, this case study illustrates the profound importance of integrity, responsibility, and accountability in medical practice. Ethical decision making requires courage, especially in high pressure situations, but upholding transparency and accountability is crucial for personal and professional fulfillment. The ripple effect of such decisions impact the entire organization's culture, building trust and setting the foundation for ethical practice. The case also underscores the broader responsibilities of government, healthcare systems, and families in addressing social determinants of health and ensuring safe and effective care.